Hello and a very warm welcome to Middle East Matters. Coming up in the programme, human rights organisations accuse the French president of turning a blind eye to abuses in Egypt as Emmanuel Macron welcomes his Egyptian counterpart Abdel Fattah al-Sisi to Paris. We head to Lebanon, where a health system that was once the envy of the Middle East is struggling to hold on to its doctors amid plummeting wages and dwindling supplies. And we hop aboard the SS Sudan, the opulent 1920s steamboat immortalised in Agatha Christie's Death on the Nile. Egyptian President Abdel Fattah al-Sisi was in Paris this week when his host, President Emmanuel Macron, said he won't tie the sale of weapons to Egypt to the question of human rights, so as not to weaken Cairo's ability to fight terrorism. Macron's comments drawing fierce criticism from rights groups who decry what they say has been a fierce crackdown on dissent on al-Sisi's watch. Catherine Clifford has the story.
Laila Souef hasn't been able to visit her son in prison for 2 months. These letters, passed on by The Guardian, are her only means of finding out how he's holding up in jail.
If I don't get a letter, I do not know that he's getting a visit. I do not know that he's alive.
Alaa Abdel Fattah is one of the faces of the 2011 revolution, a blogger who fought for democracy and freedom of expression. Arrested and released several times, he's been in jail for over a year. In June, his younger sister, Sana, also an activist, was taken away in the middle of the street by plainclothed policemen.
Not just during Mubarak's time, during Sadat's time, during Nasser's time, which is supposed to be very, very repressive. The conditions now are worse than anything.
Rising to power following a military coup in 2013, President Abdel Fattah al-Sisi tolerates no dissent. He's cracked down on all of those who've tried to speak out, whether it be against corruption or rising prices, which sparked protests in several towns across the country in September. Rights groups estimate that at least 60,000 people have been detained over the past 5 years. Human rights defender Mohamed Lotfi tries with difficulty to keep the list up to date. Among them, 2,700 have disappeared under a relentless crackdown by the regime.
Doctors, for example, have expressed their anger at the lack of medical equipment available to fight against COVID. Several of them were arrested and accused of belonging to a terrorist group and of spreading false information with the aim of damaging national security.
President al-Sisi's Egypt is now one of the countries to carry out the most executions in the world. 90 prisoners condemned to death have been hanged or shot since the start of the year. These death sentences are usually given following confessions obtained through torture.
When it comes to COVID-19, Iran is the worst affected country in the Middle East. Iran's death toll has now surpassed 50,000 with over 1 million confirmed infections. Partial lockdowns across a number of cities have recently been lifted, but authorities are warning that any fresh spike in cases will be met with a return to tough restrictions. Yinka Oyatade has more.
The doors of Tehran's historic Tahrir Bazaar are open once again. This after a partial lockdown imposed on Iran's capital and other major cities in the country forced several businesses to close for 2 weeks. But the lifting of restrictions has been marred by a grim milestone. Iran's coronavirus death toll has surpassed 50,000. Iran has the worst coronavirus outbreak in the Middle East. While restrictions have been eased in Tehran, stricter measures remain in place in 64 other towns across the country. Authorities have imposed a 9 p.m. curfew on businesses in the capital. They've also placed a ban on the use of private cars in Tehran to stem the spread of the disease. The Iranian president is calling on the public to cooperate.
شرایط تهران نارنجی است اما ما لب مرز هستیم. همه بررسی‌ها نشون میده که همه نیروهای ما باید تلاش بکنن به دقت همه مقررات اجرا بکنن اگر مقررات به خوبی اجرا نشه شهری که نارنجی شده ممکنه بعد از یه هفته بعد از 2 هفته 2 مرتبه دچار مشکل بشه به وضعیت قرمز برگرد.
Authorities have avoided imposing a total lockdown in Iran. The government is desperate to salvage the economy, which has been battered by US sanctions. They effectively bar Iran from selling its oil internationally.
For years, Lebanon was a hub for medical tourism, renowned for its world-class specialists and first-rate care. But today, the Lebanese healthcare sector is fighting for survival as crisis after crisis pushes growing numbers of doctors to seek work abroad. Many have become disillusioned in the face of falling wages and shortages of even basic equipment as the country runs out of cash to pay for imports. Linda Tamim reports.
Nearly 4 months after the August 4 explosion, which destroyed much of Beirut, the healthcare system in Lebanon's capital is still struggling, and not only because of the damage caused by the blast. Hundreds of qualified physicians are looking for opportunities elsewhere, their hopes shattered by the series of crises plaguing the country over the last year. Dr. Boutros Haddad, assistant professor of nephrology at St. George Hospital, moved back from the US with his family in 2018. 2 years later, staying in Lebanon is no longer a viable option for him.
It's a forced leave. It's not a decision that I took because I wanted to leave. The decision was taken because the overall situation is bad. Economically, it's been terrible, and the projection is going to get worse. If you have a family, now you have to think about your family also.
The economic crisis in particular was a huge blow to already underfunded hospitals, which are owed hundreds of millions of dollars by the government. Doctors are not only seeing wages fall, but also face shortages of equipment, as Lebanon is running out of hard currency to pay for imports.
We get paid in Lebanese lira, we don't get paid in dollars. So your buying power is cut to 1/4. Second, you always live with uncertainty of would you have the equipment? Is it going to be available next month or the month after? We don't know.
The Doctors Syndicate says at least 400 doctors have left the country in the last year, resulting in a major bleeding of talent. This doesn't bode well for Lebanon, which had for years held a reputation as the major hub for medical tourism in the region, a reputation it is now losing by the day.
Almost 100 years ago, in 1921, a Scottish shipyard produced the SS Sudan. The steamboat was soon put to use on the River Nile, where, in the 1930s, it welcomed aboard an Englishwoman by the name of Agatha Christie. The author later used the boat as the setting for what became her iconic thriller, Death on the Nile. And the Sudan is still very much in use today. Emerald Maxwell takes us on a tour.
It's the last of its kind, a legendary Belle Epoque-style cruiser on the River Nile. The steamship Sudan began its life nearly a century ago in a Clyde shipyard in Scotland, before weighing anchor along the Nile in 1921.
Everyone along the river knows and respects the SS Sudan. It's a historic and prestigious boat, unlike any other.
The SS Sudan used to run on coal. Now, diesel powers its piston engine. Against the current, it cruises at 7 or 8 kilometers an hour.
It's so different from our usual frantic, fast pace in the Western world. We have time here to watch life on the riverbanks. I love this slow and steady pace.
There are 47 passengers aboard, paying between 2,000 and 3,500 euros each to sail in style from Luxor to Aswan over 6 days with full bed and board. They follow in the footsteps of a British writer who took her place aboard the steamship in the 1930s while accompanying her archaeologist husband. Her name was Agatha Christie. One of her most famous novels, Death on the Nile, is said to have been inspired by the voyage. It's a trip that then and now takes in ancient Egyptian sites. Edfu, on the west bank of the river, is home to the Temple of Horus, one of the best preserved ancient Egyptian temples. Long forgotten under tens of meters of sand, it was only uncovered at the end of the 19th century. Nowadays, more than a third of Egyptians live in poverty, and tourism makes up around 15% of the country's economy. The SS Sudan's deckhands look after her like a treasure. As long as she sails, they have work. Now beautifully restored, the steamship was in a pitiful state when a French tour operator found her 20 years ago, moored to a quay in Cairo. It took years to renovate her to modern standards while maintaining the old-fashioned charm that her passengers crave.
It's magnificent, really dreamy.
It's not cheap, of course, but it's worth it.
From conquerors to writers and artists, Egypt has fascinated and inspired travellers for millennia. It retains the same romance for visitors lured along the Nile today.
Well, that brings us to the end of this edition of Middle East Matters. Don't forget you can watch this show and others on our website, france24.com. Thank you very much for watching and see you again next week.
A rumour, a mirage, the prospect of a future, enough for them to go and leave everything behind. These Ethiopian refugees are exhausted, but they have one remaining hope: to survive. They're fleeing from death. They're looking for a refuge, for shelter, food and water.
They didn't give me steel now, so I'm really pissed off.
In this moving episode of Reporters, we look at the fragile hopes of the generations of Ethiopians who are fleeing their country for Sudan.